There was a recent article in The Lancet which brought up an interesting point about evidence-based medicine and how to apply it in practice. This was an article that looked at Lynch syndrome, which is hereditary colorectal cancer, and looked at the role of high-dose aspirin compared to placebo in preventing these tumors. They randomized about 860 patients, and what they found was that after about 10 years, the risk of having a colorectal cancer was reduced by about 35%. This story was then picked up by a number of news sources, which then talked about the fact that patients should discuss the option of taking aspirin regularly with their GPs. So if you're a general practitioner and a patient comes in having seen this information, how do you apply the evidence? Well, what you want to do is to use evidence-based medicine, and that's defined as the conscientious, explicit, judicious, and reasonable use of modern best evidence in the making of decisions about individuals. This was the original definition, and there have been subsequent changes where, for example, best evidence has been replaced by best available evidence. It's also been added that it integrates clinical experience and patient values with the best available research information. The really key thing here is the fact that what we need to look for is not just the evidence from this paper, but the best available evidence. And as we talked about previously, there is much greater evidence about the role of aspirin in primary prevention. So this meta-analysis, published in June of 2019, looked at 15 randomized controlled trials and included 165,000 patients. And they found some benefits of using aspirin, but also some harms. And so overall, what they concluded was that if you gave 10,000 patients aspirin for primary prevention, the benefits in terms of cardiovascular prevention were really outweighed very much by the harms in terms of bleeding, and that included intracranial bleeding, which can be quite devastating. So how do we apply this evidence with this most recent study and combine it together? So if we combine these studies and we looked at, for example, 10,000 patients at high risk of colorectal cancer, then the best available evidence would be that we would have 400 fewer colorectal cancers, but that would be over about 10 years. This may result in a change in death, and the death from cardiovascular causes and total strokes would stay the same, as would the other benefits in terms of cardiovascular events. What we would see, though, is because a higher dose of aspirin is used in this study, in fact, we would get more major bleeding events, particularly coming from an increased number of gastrointestinal bleeds.